The energy from our fourth annual virtual Sjogren Summit has been absolutely incredible. I am still buzzing from all of the conversations, the connections that are being made, and truly healing in action. It is human connection that really fosters a healing environment. Hi, everyone. My name is Dr. Wada. I'm a quadruple board certified physician specializing in pediatric and adult allergy, immunology, and lifestyle medicine. I'm also a patient. I live with Sjogren's disease and dysautonomia, something called orthostatic intolerance, which is just a really fancy word for saying my blood pressure does annoying things when I'm trying to have fun. And this dual perspective of seeing the world through the lens of a physician and that of a patient is at the very heart of everything I do. And today I want to talk a bit more about how those two worlds collided, something deeply personal, and something, frankly, I don't think I could have talked about, especially in this way, a few years ago. It's strange, and at least surface may seem a bit Pollyanna, but I've come to realize that getting sick, getting that diagnosis of Sjogren's disease was actually one of the best things that has happened to me as a physician. And I know that sounds counterintuitive, but my diagnosis didn't just change my life. It fundamentally broke and then rebuilt my entire understanding of what it means to practice medicine. It forced me to become the physician I always wanted to be, but was a bit scared to take some of those leaps and those risks that needed to be taken to get there. And today I'm going to tell you a bit more about how. So before my diagnosis, I think I was a pretty good doctor by, the traditional metrics. I, at the time, was already board certified in pediatrics, in internal medicine, in allergy immunology. I worked at a prestigious academic institution at The Ohio State University. I was on faculty there. I had achieved, graduating with honors. I was elected into the Honor Society, AOA. I knew the textbooks. I was doing research. I got some funding for some patient safety work I was doing. I knew the studies, the protocols, blah, 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 blah. Got all the gold stars. The good little girl who turns out actually had ADHD, and so she channeled it. But I could diagnose complex allergic conditions, and I could manage intricate and very unique immune deficiencies. I was pretty confident in my knowledge, also knew when I didn't know what I didn't know. But looking back, I also was very limited. I think even before my diagnosis, I did have those inclinations to go beyond the textbook, but I still was fresh out of training. I really looked to my mentors and those textbooks as, as my, almost as like religious texts, right? That was kind of what we used. It was all we knew. And I saw the patients I was seeing more through a lens of data and lab results and differential diagnoses. That's the list of all the things we try to think that could be causing the symptoms you're sharing with us. And I listened, but I was listening for clues that really fit the patterns that I was trained to recognize. And this is something that we call, and that can lead us towards something called anchor bias. We anchor the information that we learn in training, and it can cloud our ability sometimes to see what's really in front of us. We get fixated on a particular diagnosis that we see often or that we encounter. And especially in a rushed clinical environment, we stay focused on that and don't look at the other possible options that might be out there. So if a patient came in with a long list of what seemed to be somewhat disconnected symptoms, their labs are normal, a part of my brain would quietly file that under anxiety or fibromyalgia. That's what I was taught. I had empathy, but it was a bit more clinical. I couldn't truly understand that lived experience of crushing fatigue or the cognitive terror of brain fog or the profound isolation that comes from that feeling of being on the other side of the exam room and having that lived experience dismissed. I was treating diseases in patients, but I wasn't always seeing that whole person living inside that perfect storm of symptoms. And then the universe decided to give me a bit of a crash course. So coming back from maternity leave after having my second child, Josie, I had truly this fatigue that I tried to chalk up as to being still a new supervising or attending physician, a new mom of two, but the fatigue was so profound that it felt like my bones were made of lead. My back stiffness was terrible. I had already been dealing with some dry eye. I wasn't able to wear contacts anymore. I very rarely put on mascara because within, an hour or two, I looked like a raccoon just from rubbing my eyes. But the most terrifying part to come to realize, especially in hindsight, was the medical gaslighting wasn't so much from others, though I did have elements of that with my peers and my colleagues, but really from myself. My own training was telling me that this is just, tired mom syndrome. This is just what doctor moms do. And maybe it is just too much stress I'm putting on myself. And, here I was then, suddenly on the other side of the exam room, sitting on that, that crinkly paper on the exam room table, holding my own list of confusing and profoundly impactful, life-altering symptoms, feeling that same desperation that I had seen in my patients, but I never had truly understood it. I experienced that frustration of those, shorter appointments, though I'm sure my colleagues gave me a little extra time because, quote unquote, professional courtesy, one of the many privileges that I come to realize that I have in navigating healthcare. God, the anxiety of waiting for test results, the soul crushing feeling of not being believed, and that odd sense of relief, joy, I don't know, like this mixed, like bittersweetness of having test results actually confirm your suspicion. It was the most humbling and shortly thereafter infuriating a situation. And it truly changed everything. My diagnosis didn't just give me a name for what I was experiencing. It really gave me a new lens to which to see the patients I was caring for. And it's truly taught me how to be a better healer. And here's what I've learned. I've learned to listen differently. I continue to listen for diagnostic clues. That's part of the process. It's part of the art and the science of medicine. But I really started listening to the story. The patient's narrative is the most important piece of data we have. It is more valuable than any single lab test. Second, I started to conceptualize the perfect storm. I stopped looking for one singular diagnosis or root cause, or like all of that is BS, frankly. Everything within us and around us is interconnected. The immune system, the nervous system, our environment, our stress, our trauma, our relationships. You can't treat one part without acknowledging the whole. I love to crochet, though admittedly I haven't done it in a little while and I need to change that. Anyways, so I have bins of yarn upstairs, and there's a situation where my daughter really got into crocheting too. And so she got into the yarn, and there were a few balls of yarn that got all interconnected and entangled, right? And that's how I really have started to visualize this perfect storm. You pull on one thread, it tightens the other. You got to like work through things along the way, figuring out what some of those threads are that are going to move the dial a bit more than the others, that 20% that moves the 80%. The third thing I understood was the vital importance of the network. A single doctor can't be the entire answer. A patient needs a team, a network of supportive healthcare professionals, a family, peers. It is the entire reason we built this year's summit around that very theme. And finally, my own journey forced me to live the 4R framework that we've developed, the Immune Competent Institute. I had to recognize the flaws in the system and in myself. I had to reclaim my own story and believe my own body. I had to rebel against the status quo of dismissive care. And now I'm dedicated to helping my patients and all of you rise to a better tomorrow. Everything I've learned on this journey, every hard-won piece of insight has been poured into the work we do, especially the virtual Sjogren Summit. The summit isn't just an event for me. It's the resource I wish I had when I was at my lowest. It is a manifestation of the kind of medicine I believe in, accessible, empathetic, and built on a foundation of community. We just wrapped up an incredible live event for 2025, and we are learning, and the learning and the connection doesn't have to just stop. For everyone who joined us and for those who couldn't, we want to make sure this knowledge remains available. Based on your feedback, for those who attended, we've created something even better than kind of the live pass. We've created an evergreen resource for your entire journey. And today I'm excited to introduce the Sjogren Summit for your library. For just $97, you get a lifetime of on-demand access to every single session from all 4 years of our annual summits. It's over 80 hours of expert presentations, patient stories, and panels from 2022 all the way through 2025. It's an entire vault of knowledge covering nearly every aspect of the disease for less than a cost of a single specialist visit or even the copay. This is our commitment to making this information accessible for the long haul. Now, and a special note for incredible 2025 All Access Pass supporters, you just invested in this year's summit, and we are so grateful for that support. We want to honor that. Please check your email for a special message from me with an exclusive thank you offer to complete your library for just a small fraction of the price. That's our gift to you for being an early supporter. For everyone else, this is an opportunity to get the entire collection in one place. My journey with Sjogren's has made me a better physician because it made me a better listener, a better advocate, and frankly, a more compassionate human being. It's taught me that healing happens in community and in those connections between each of us as human to human. Whether you're a patient, a caregiver, or a healthcare professional, I hope you'll continue this journey of learning with us. Thank you for being here. Thank you for being a part of this network, and be well.